You're listening to Show Me the Evidence.
Hi, everyone. Welcome back to episode 5 of Show Me the Evidence. We are so excited to have you this far along in our journey. I'm Casey.
I'm Bethany.
And we'll be joined by Dr. Hawley and Dr. Naseri today to talk about global health, specifically Samoa and the measles outbreak that happened in 2019, really giving us an inside look at what happens when vaccination rates drop, when vaccine hesitancy increases, and potentially an inside look to what could happen here in the U.S. If we're seeing kind of the discourse continue. I want to hand it over to Bethany to introduce our wonderful guest.
Yeah, so you might notice we look a little different today. We have these big headphones on because we're so lucky to be joined by Dr. Take Naseri, and I'm going to read a brief bio about him. So Dr. Take Naseri served as Director General of Health and Chief Executive Officer of Samoa's Ministry of Health during the 2019 measles outbreak. A practicing physician with a master's in public health from the University of Queensland and a medical degree from the University of Papua New Guinea, he has served in the ministry since 2010 and was instrumental in establishing Samoa's National Disease Surveillance Division in 2012. During the outbreak, Dr. Naseri led the government's crisis response, overseeing the mandatory door-to-door vaccination campaign that restored coverage from under 40% to over 90% within weeks, and has since spoken candidly about the role that vaccine hesitancy, communication, and outside anti-vaccine influence played in enabling the crisis. He subsequently became an adjunct associate professor of epidemiology at Brown University's School of Public Health and remains a key voice on vaccine confidence and Pacific Island public health resilience. So welcome, Take.
I'd also like to introduce Dr. Nikki Hawley, who's an associate professor of epidemiology here at Yale and a leading global health researcher whose work examines how pregnancy and early life environments shape lifelong cardiometabolic risk. She partners closely with Pacific Islander communities and global collaborators to develop culturally grounded interventions that address maternal and child health disparities. Her research portfolio spans gestational diabetes, childhood obesity, and intergenerational disease prevention. We are so excited to have both of them here with us today, and let's jump right in.
On October 16, 2019, Samoa became the first Pacific Island country to declare a measles outbreak during this global wave. By January 22, 2020, 5,707 cases and 83 deaths had been recorded, with 87% of deaths tragically being in children under 5. This was largely due to a collapse in MMR vaccination coverage from 99% in 2013 down to just 40% by 2018.
If we can get perspective from both Nikki and Take on your point of view of the measles outbreak in Samoa. Just kind of a general understanding of what it looked like, the impact, and then we can kind of dive into some more specific questions.
There was a disaster for the vaccination, and it was measles, where two infants were, involved in a very sad situation that because of the mistakes in how they were giving the vaccination, and from a dilution solution of the vaccine, and we lost 2 lives within an aspect of 4 hours. So we restarted the vaccination program again. But by that time, the people were so reluctant. They were so reluctant, they lost their trust, particularly the young couples with a good level of literacy, because now we have a problem. So, and there was word around. So finally, we got down to the bottom of the investigation. And around that, but by that time, by October that year, we had a big outbreak. But we restarted the vaccination around March, April. But the people were not coming in. We had to open ours, expand we have a big measles recovery plan. Around that time, we were looking at all those areas. But during that time, that was the problem. Even when we started looking at the young children dying. So when we look back at the records from the National Health Service, our vaccination rates were way down around 54%, some 48% coverage after first dose. They even had a catch-up campaign under the NHS in was it 2014, which they claim to achieve 95%, which when I looked at it, I think they calculated wrong. The denominator was not right in their coverage. But it goes back more than 10 years that the vaccination was around 68, 64. But we all know that the proportion that are not vaccinated, they accumulate over the years. And it was interesting, we found, we analyzed the records of the few of the mortality cases. The mothers were even unvaccinated. Like the 20-year-old, they were even unvaccinated for measles. So it was the accumulated percentage. So it was a disaster in the making. So it was a big wake-up call.
That was something I think, though, it's maybe missing in the public narrative about this. And people looking from the outside, I think, tend to think that the tragedy that happened in 2018 with the two babies that passed away started this whole thing. But I think, as Dr. Naseri is explaining quite nicely, this was something that had been brewing for a long time. Vaccination rates were already low for many reasons. And so I think that's a little bit of a gap in the public perception.
And I think thank you for sharing that. I think it's really important. A lot of the conversations we've been having with other guests is this idea of the US kind of starting to have this vaccine hesitancy and what lower vaccination rates could do. We know that we need that 95%, especially for measles, to prevent outbreaks. And so I thank you for sharing that. I think it's helpful for understanding that it's not just something that happens overnight, but something that really takes some time,
Accumulates.
and really is almost like a system gap. So thank you, Take, for sharing that.
At what point did the ministry become aware that coverage had fallen to a concerning level? And at that point, what were the options available to address it?
Well, as I've said, the rates have been low prior to March, because when I took over the Ministry of Health, the main role was regulation and border control. By the time we sort of get declared the outbreak, I think we were about 2-3 weeks late in officially declaring the measles outbreak, because we had challenges also in confirming the measles. Because we don't have a laboratory capacity to confirm the measles here locally. So we sent specimens to New Zealand. Around that time, New Zealand was in the middle of a measles outbreak also.
Yeah.
So they asked us if we can send it back to Australia. So we have to send it back to Australia.
That must have been such a challenging position for you as this public figure who was leading the Ministry of Health at that moment, like clinically thinking, yep, this is measles, we've got a problem, but really having to wait for those test results to come back so that you weren't kind of flagging something false. That must have been just so challenging to manage.
As I said, there were so other things going on at the same time. We were trying to not only to restructure, we have to go for it. It's a huge process, and people were not feeling right with the match. There were certain people that they were not feeling right.
I remember.
What I did was I just focused on the clinicians, the nurses. And it was this measles that reveals all the gaps in our own work and our own process in the clinical perspective.
Okay, one of the things I was just amazed by when reading about this is how successful your vaccination efforts were. It really, I read a stat saying it went from 40% to 95% in just 6 weeks, and that from a public health standpoint is just really remarkable. I'm wondering if you can share what this campaign looked like on the ground and why you think it had so much success.
Well, it's one of those things that I'm very proud of. Doing something that really had an impact. But the main factor was the trust the government gave us, the political will to give us. Because despite our increasing number of hours having teams, it was the public response was very slow. So when we declared, we have a process here. Once we declare a national emergency, so we have to activate the government. The National Emergency Operation Committee is led by the Prime Minister, and then the CEOs of the Ministry of Health, and most ministries are in this. So that was the process. So it was the political will that I thought, and everybody moved in to assist. I can say that when we requested that we're going to have this tragedy where we close down the whole government for 2 days, they stay home. Even the public transportation, everybody stayed home, and we used all the government public servants, volunteers to build up teams, and then each zone we allocated to different CEOs, and we advertised to the public that they put a red flag or something, no, if they know that they need vaccination, and we asked them stay home, stay home, stay home, and wait. We will bring the vaccination to you.
The organization, just watching it from the outside, was so spectacular. Like you said, you put together these teams, and there was a vaccinator, a nurse, a data collector, everybody, everyone had vehicles and coolers for the vaccine and the warehouse coordination. I mean, it was like truly remarkable to watch in real time. It was amazing.
That's amazing. Okay, did it seem from the public's view that measles became politicized? I think we've been talking a lot about this idea of public trust. You mentioned that the public was a bit hesitant, which was a little different than the government, which kind of came on board quickly. How did you start to kind of gain public trust, build it up, and how did you use this momentum and political will you gain from different government entities to try to kind of fix some of that damaged trust that might be there with the public so that you go from having red flags outside people's doors who aren't vaccinated to actually getting them vaccinated and wanting to get vaccinated?
As you've mentioned, the public in general, they were so undecided. They were undecided. The village people were okay because most of the village council, the chiefs were rallying behind. They said, "We have no choice. This is the only proven solution is to vaccinate everyone," because we were on the radio, on every social, on the media, trying to convince them. And they have noted also that there was a lot of teams, global emergency team, coming to Samoa. I think one of the biggest, a lot of international teams came down, but they were clinicians to assist. And what I was trying to say before was that when we asked the people to do the red flags to indicate that the people so close, walking distance to the hospital, they even have their flags up. It was Prime Minister mentioned that around that time. I cannot believe people so irresponsible for that. But then it's all a matter of trust.
Yeah.
Right.
It's their own consent. So as I've said, I think it was when the outbreak actually happened, it was on its height. That was when people started politicizing it. And that was when the vaccine anti-vaxxers, as they call it now, they were, starting fuming the flames of mistrust. When we reached 90%, you can see the cases just going down dramatically.
Yeah.
Very significant drop. So that's when people realized that we were right all along.
Something that we have talked a lot about on the podcast so far is how vaccines are a victim of their own success. And people oftentimes don't see the value of them because they haven't lived through a tragedy such as this one, where they've seen what the effects of a drop in vaccination rates create. And here in the US, we're dealing with an uptick of measles cases. And I'm curious, Take, from your perspective as someone who has lived through watching vaccination rates fall, what you would say to people who don't see the value of vaccines here in the US.
Well, vaccination is prevention. And I think people should understand that it's, we've been living freely and, in a state of well-being because we've been prevented by these vaccines. We don't want to ask for trouble. If you don't get your vaccine, then, everyone wants to live up to 80 or even 90. Then somewhere along the line, you might get this disease, especially this disease. And then it'll be too late. You will regret it, but you missed the chance to get your vaccine. Or it will be too late, and you might be responsible for transmitting this deadly disease to one of your close relatives, your loved ones. People should not get carried away with the well-being they are now. That's one of the things. And as you mentioned, a victim of your own sex, it can happen nationally. During the COVID, we mentioned the COVID, we had very good border controls. So when the vaccines were introduced, we were quite the last on the list of the Pacific Islands to get because we didn't have cases.
Yeah, exactly. I wrote about this. I wrote about this after it happened because Samoa kind of went through this experience right before COVID-19 happened, and your borders were closed, so COVID-19 took so much longer to get out to the Samoas. But this kind of experience of galvanizing a team like this, and the fact that there were many of the symptoms of measles are respiratory, and all of your clinical staff got all of this additional training in advanced respiratory therapy, just kind of uniquely prepared Samoa to be buffered against COVID-19. And I just it was serendipitous timing, but put you in a really unique position of strength going into COVID-19 that I think no other country at the time was in.
So the priority was given. And I don't blame the people who were doing the decision making of distributing the vaccines. So I was arguing, no, you should help us first because we did our best to so they will distribute, but we continue to bother them. I remember one of the UN reps, we were in the committee that we were doing the health advisory. He used to tell me, well, sorry, you're a victim of your own success. I just said, okay, this is what happened, but it can happen at that level also. So in case we look at the level of the people, it can happen also at the level of at the federal level or even the national level when people say, oh, let's miss the vaccination, cut the budget for the vaccines. Nothing is happening for the past 10 years.
Yeah.
See? So that can be a problem also.
Nikki, if you don't mind, if I ask you a more pointed question, kind of this idea of public health vaccines being a victim of their own success, the work you do with both Samoa and American Samoa, you kind of saw the 2019 outbreak, saw COVID, and then the 2023 measles outbreak in American Samoa.
Yeah, I mean, I'm not an infectious disease specialist, so
Yes.
I'm grateful to be here just for my context. But yeah, I mean, I think that this is the invisible part of public health, right? The point is that if we do it well, it's invisible.
Yeah.
Nobody has to worry about it, which is where the victim of its own success comes from. I think that very much so, unless you live through a tragedy like this, it's hard to even imagine what this looks like. There are a lot of clinicians who are graduating in the US now who've never seen a case of measles never treated a case of measles because they haven't had to. One of the things that I love the most about my work in both American Samoa and Samoa is just like the sense of community. I love working there because these are people who feel so interconnected with one another. There's a level of altruism that is just rife in the culture where people do things to serve their family, to serve their community. And so in many cases, like those values, which I think the US has lost a little bit, really helped with this particular situation because people were able to come together and see the impact not only on themselves, but also like the need to do something wider. I think American Samoa is an interesting case. They are much more exposed to U.S. narrative, to U.S. social media than independent Samoas, who also, obviously, as Dr. Naseri just mentioned, have issues with social media and anti-vaccine rhetoric that happens particularly in a concentrated way there. But in American Samoa, I think it was tough to have lived through this lockdown related to COVID that felt enforced even though they didn't have cases. So there was a lot of mistrust in the territorial government because of that. Like, we don't have cases. Why are we being punished for this? And then, and you also want us to be vaccinated and do all the things that you want to do. And so this kind of tension between individual freedom and government control is challenging there.
Thank you. That's really informative.
Nikki, while we have you here, I want to make sure that we ask you a question about NCDs, or non-communicable diseases, since this is your area of specialty. So I'm curious if you could tell us about the role that vaccines play in non-communicable diseases.
Yeah, of course. So I teach a class here at the School of Public Health on global non-communicable diseases. And at the start of this semester, I asked students to tell me a little bit about what they know about this particular category of diseases. And they quite often get everything right and say, these are long-lasting conditions like diabetes, hypertension, need to be managed for a long period of time. The symptoms often don't appear till quite late in the disease course, but someone almost always says they're not infectious.
Yeah.
And I have to stop for a second and say, well, let's think about that a little bit more, because actually there are some non-communicable diseases that have their roots in infectious disease. So, for example, cervical cancer is quite often caused by HPV virus, and there is a vaccination for that. And so high vaccination rates around that have been extremely important in wiping out cervical cancer in some places. In Samoa specifically, there's also something interesting in terms of childhood obesity. So some of the data from studies that Dr. Naseri and I have done together really show that there are kind of two phases of childhood obesity development that happen, and that the first phase is driven not by children gaining too much weight, but not gaining enough height. And so then when we look at their BMI or their weight to height ratio, it looks like they have obesity because they're shorter than the global average. And that comes from infectious disease, from some exposures during pregnancy. And so vaccination in the very early phase of life probably plays an important role in childhood obesity prevention. So things we don't think about in terms of the overlap between the two.
Yeah, that's fascinating. That's going to be especially relevant as obesity is rising in the U.S. We have to think of new prevention strategies. So I think there's a lot to be work to be done there. Okay, Take, I'm going to ask you a question now. Family is everything in Samoa. The outbreak disproportionately claimed the lives of very young children. This is an enormous weight for any public health leader to carry. How has this experience shaped the way that you think about vaccine advocacy and the role that vaccines play in keeping families safe?
I myself, I fully sort of believe in the role of vaccination in preventing. I think we have 16 vaccine preventable diseases in Samoa. We have a big, and I signed, I think 2018. I had to sign for Samoa to access 3 new vaccines. That's the rotavirus, the pneumococcal, and the HPV. My position on vaccine will never change, particularly with what I went through, because I've seen the saddest part of life when we lose 6, 8 children in one day for being unvaccinated. And then I've seen how dramatic the change is once we achieve that 95%, 93, 94% of coverage. So, vaccine is history. We've learned a long way. And we know that there were other diseases that have been prevented by the vaccines successfully. Otherwise, for a country like our small independent state, we cannot go without vaccination. It's going to be a huge burden. Now, even measles, that's been a huge burden for a small nation. So, even all my relatives, my brothers and sisters, they all know that vaccination. We were brought up with vaccines. So why stop now when we've seen the successful side of it? So there is no question. Even people I talk to, they cannot convince me not to vaccinate my children. Even my grandchildren have to tell them get vaccinated.
We've been asking our guests this as the last question for all of them. So we'll start with Nikki and then finish with Take. What do you think is the most important thing for people to understand about vaccines and how decisions around them are made?
I don't know that I want to talk about what people should understand, but I'd like everybody to just remember the humanity involved in this. I think Dr. Naseri spoke wonderfully to the experience of seeing this, but everybody is making decisions with the information available to them. And I think we need to just remember to treat each other as human beings in this very difficult conversation, and hope to find the middle ground and improve vaccination as a whole.
I don't want them to understand. I want them to know. I want them to know that vaccines prevents. Uh, Vaccines doesn't cure. It's what happened in Samoa. It's more a human error in implementing the vaccine, and we've gone a long way with vaccination, and even maintaining the gold standard it's a huge process. So people should feel safe, with vaccines, and it can prevent both not only the economic costs but life. Life. That's what. I think that's what I want to say to those who don't believe in vaccine. They have to know and believe in it.
Well,
Thank
thank
you.
you, Take. Fafatai tele lava. We really appreciate both of you guys coming on with us today, and hope viewers enjoyed listening to this really impactful conversation.
I just want to say, as always, all of the evidence that was used for the episode will be linked in the description. If you're curious, you want to learn more about this topic, please feel free to look at all of those articles below. We were so grateful to have our both amazing guests with us today, and we hope you enjoyed. This was yet another episode of Show Me the Evidence.